how does a nurse navigator then interface with the rest of the medical team? The other nurses, the doctors, the technicians?
So there are collaborative navigation models where the navigator is more in a coordination role of care that's in a team. That's a part of, as a team member, I should say. As a team member, that person also works collectively with other members of the team in caring for the patient. You can have a situation where it's really, I call it kind of a handoff, if you will. For example, I see patients at our cancer center in Napa. I see them at the time of diagnosis. Or every patient that comes in sees the navigator first. So I set the pathway for them. Then when they begin treatment, when they've made a decision where they want to have treatment, then the treatment nurses or the radiation oncologists or the medical oncologists kind of take over that care. I'm sort of in the sidelines at that point. Then when they finish their treatment, another huge part of navigation for my role is Survivorship Program. Well, how often should they come back? What tests should go on? What do I need to be aware of? When does my daughter get her first mammogram? The whole educational process in navigation and survivorship is, again, an unmet need. And so I think navigators can traverse systems, and I call myself a navigator without walls. So I can see the patient in the hospital, in the doctor's office, wherever they happen to be. I follow them.
And what about the objectivity of a nurse navigator who may have a patient that has a unique cancer, a very particular situation, and there may be limited places throughout the United States, centers of excellence that are set up, whether it's a type of a machine or a technology or a clinical trial? How do we deal with that sense of objectivity so the patient knows that they're getting to the best cancer center for their given situation?
In our cancer center, we have a full-time clinical trials nurse. So the navigator, basically, there may be a situation where a patient is calling into the center and wants to know about available clinical trials. For example, just for an example, a PARP inhibitor trial for breast cancer. That clinical trials nurse helps me find or facilitates patients entering into any National Cancer Institute trial. If we don't have the trial or a nearby university doesn't have a trial, we figure out where that trial is and help facilitate care for that patient to go to that trial. In another way, as a rural-based, freestanding nurse navigator that I function in Montana, it was part of my role to help patients navigate them all over the country. You have to have institutional support to do what a pure navigation role, as I'm describing it, really is. You can't take a naive nurse navigator and put her in a highly sophisticated system, nor can you take a very experienced nurse navigator and put them in a system that's not ready to embrace that concept. And it's evolved from, morphed from being a clinical nurse specialist. There's a lot of different titles, I think, and a lot of blending of the role that has occurred over time. And I think that getting outcomes documented, looking at how do we measure that navigators do indeed make a difference for a patient.
What's core, because we're dealing with a life-threatening illness, is that the ability for your nurse navigator to understand the complexities of your own cancer, because each one of us, no matter if we have the same disease, it's different for each person. And to me, the first important thing is assuring that the patient is clinically on the right track, and only a well-trained oncology nurse navigator can do that, because that's not what the lay navigator is trained to do.
I think a highly skilled navigator also is very clear about where second opinions can happen and how to facilitate that. In our particular center, we have an affiliation with the University of California, San Francisco. So for patients, I can help facilitate them. They have what's called a concierge service. So I can call the concierge and get the patient into a tumor board or get the patient in to see a specific specialist. We also, I think the other thing that will really be hugely beneficial for patients is to have, you know, the technology. We have the technology to do virtual tumor boards. In other words, patients can be presented and physically don't have to necessarily be there. And I think that's critically important because cancer takes so much of one's time and emotions, physically, emotionally, spiritually. So if you can save that patient time by having a virtual tumor board so that the patient doesn't have to get on a plane and fly to Duke or get on a plane and fly to the University of Washington, we need to facilitate that.
And I also would imagine that with these changing times in healthcare and access, that the role of nurse navigators is only going to become much more intense. Where do you see the future?
I talked to the founder of the navigation concept, my hero, Harold Freeman, just recently at an American Cancer Society meeting. And I love his statement that no patient should spend more time fighting the healthcare system than they do fighting their disease. So I asked him, what is your vision, Dr. Freeman? And he said, I want for every cancer patient to have access to a navigator and every major cancer program to have highly trained navigators. Now that may mean a lay navigator in a lot of underserved, a population with very poor, low-income patients that are a part of that culture that can help bring those patients to the centers. Transportation's huge. So for many patients, it's if somebody will come pick me up and take me to my appointment as a lay navigator, that's hugely beneficial.
Well, as we've been talking about throughout the day, the multidisciplinary nature of cancer, it seems to me that the newest member to that multidisciplinary clinical team is this nurse navigator.
Mm-hmm. And the nurse navigator has to be successful, has to have institutional support. I've said that before, but I think it's really very, very important. For example, in one of my job descriptions as a breast nurse navigator, in one of the kind of scope of responsibility is that the nurse navigator will advocate for the patient for the best possible outcome. And that best possible outcome may not be in the institution the navigator works in.
That's where that objectivity comes into play.
Another part that we haven't talked about is, and how do you help patients go through the 3 inches of printed material that they bring to you? Where do you start? And that's what I think is important. I always tell patients, I'm going to walk you out to where I see your next horizon is going to be in the distance, but I'm going to bring you right back to what you need to do within the next 24, 48 hours.
All right, so I just want the patients and viewers to hear the message that there are nurse navigators and then there are oncology nurse navigators. And if you have cancer, you want to make sure you have a highly skilled, objective oncology nurse navigator.
For me, it's kind of the culmination of my life's work to be able to help guide patients in this way.